A number of respiratory viruses are reportedly making their rounds this spring, and health pundits are calling on the public to practice good hygiene and to avoid crowded places. So what viruses are going around this spring? How severe are seasonal allergies during this time of the year? And what can be done to ensure health against fine dust? Welcome to Issues and Insiders. Spring is in the air, and today we address efforts to ensure health against seasonal respiratory viruses and more. For this, I have Professor Jung Ki-Suck from Hallym University, who's also the chair of the Committee for Disease Response here in the country. Professor Jung, it's been a while. Welcome back.
Thank you for having me.
I also have Professor Kim Moon-Kyu from Yonsei University with us. Professor Kim, it's a pleasure to have you with us.
Thank you for having me.
Right, Professor Chung, first then, how do you explain the prevalence of respiratory viruses in the spring?
Well, the winter is most prevalent for respiratory viruses. And in summer, we don't have many patients with respiratory virus infection. And the spring is in between. So we still have influenza, especially type B, and other viruses as well. The reason why we have respiratory virus in the spring is because of dry air and some air pollution due to atmosphere stagnation. And still we have a large fluctuation of temperature at midnight and then during daytime. So all that causes people prone to be infected by respiratory viruses. So I would recommend people to still pay attention to a respiratory viral infection.
Right, of course. Professor Kim, I hear human parainfluenza viruses continue to affect our children here in the country this particular season. Could you tell us a bit about those symptoms and the severity of parainfluenza viruses, as well as the treatment options available?
Yes, this is very common in children, and usually it takes about 2 to 6 days of incubation time to have symptoms, usually transmitted by air droplets and sometimes by close contact, and usually happens in springtime. Reinfection is also quite common, so if you had a parainfluenza virus last year, you might have another one this year. Symptom is quite common as fever, cough, runny nose, sore throat, and sometimes you have poor appetite. And some children get very severe, and they might develop into croup, pneumonia, and sometimes bronchiolitis in an infant. Croup is a disease of the upper airway causing a very noisy cough. Sometimes we call it breathy cough, and everybody knows about what pneumonia is. Prevention, there's no vaccine for this one, but we think that about 70% of our population have an antibody against this virus. And to prevent it, personal hygiene is important. So you just do as we did during COVID-19, and that will be enough. Treatment is very symptomatic, and you give some antipyretics such as Tylenol or acetaminophen. But I always insist that you must encourage the patient to drink more water. And how do you know he had enough water? Check the urine. It should have enough amount, and the color should be very dilute, and antibiotics are not needed for this case.
Right, I see. And Professor Jung, what can you tell us about the respiratory adenovirus? I mean, what are its symptoms and how can it be treated?
Well, adenovirus sometimes causes a very severe infection, both in children and adults. Unfortunately, we don't have a vaccine or very effective treatment. Apart from that, there are so many viruses around us now. He mentioned about the parainfluenza virus. Still, we have a quite high number of influenza virus, but luckily we have a vaccine and treatment options. But other viruses like metapneumovirus, respiratory syncytial virus, which causes a very severe disease in particularly very young children, and there are many viruses, and still they are prevalent. There is a good news for one thing, that is respiratory syncytial virus. one company is going to develop a RSV vaccine, and maybe in the market by the end of this year or next year. So having said that RSV is a very severe respiratory virus causing death in very young children, that's a very good news. But unfortunately, we do not have very effective antiviral agents, except for influenza. And COVID-19 is another respiratory virus. Luckily, we have a drug for that, but not for very young children. So we need more effort to develop vaccines and treatment options.
Right, of course. And against that backdrop, Professor Kim, how does one tell the difference between the common cold, the seasonal flu, bronchitis, as you mentioned, as well as pneumonia?
Well, common cold and seasonal flu is almost same. You cannot differentiate it by the symptom. But both of them are from virus, but the flu is by influenza virus, and common cold by hundreds of viruses, as Professor Jung mentioned, and coronavirus, parainfluenza, rhinovirus, you name it. Flu is more intense compared to other respiratory virus and starts more abruptly, and usually starts in the fall or winter time of the seasons. And if I compare with bronchitis, bronchus is the airway going to the lung, and upper respiratory tract infection usually have a dry cough, but bronchitis starts dry but becomes wet, like more productive. And sometimes you have bacterial bronchitis also. Usually you have some kind of fever, and some people call it as a chest cold. And if this upper respiratory tract infection becomes longer, you might develop into bronchitis also. Pneumonia is an inflammation of the lung itself, and usually it has a high fever and lasts more than 5 days of fever and cough, and shortness of breath and fatigue, poor intake. So if you develop pneumonia, usually the patient have to admit to hospital. So whenever I see the patient, I ask for the duration. If it approaches 5 days, then I think of the possibility of pneumonia and take the chest x-ray and go for the treatments.
Right, I see. Professor Jung, as you mentioned earlier, seasonal allergies are also sources of very much a concern as well as discomfort during the spring season. What can you tell us about ways to perhaps ease their symptoms?
Well, you need the treatment to ease the symptoms. But first of all, you need to find what is causing your allergy during springtime. During springtime, usually pollens from cedar tree or birch tree or alder trees are causing various allergic symptoms. It irritates the eyes and causing itchy eye, and also itchy nose and itchy throat. And it causes conjunctivitis, allergic rhinitis, and sometimes bronchial asthma. So you need to avoid the pollens. But you don't have much way to avoid any pollen. If you go out, the pollens are all over the atmosphere. So at that time, you need a mask wearing. So mask is not for COVID-19 solely, but for allergy patients, and also for preventing pollutants. So if you have any allergy symptom, you need to get a medicine, such as antihistamine, which depresses, decreases irritation of your mucosa. So it decreases the itching in the nose or eyes, and etc. And also you have other treatment options, very specific treatment like anti-inflammatory treatment like a steroid, or anti-allergic drug to decrease inflammatory change in your nose and eyes and bronchus. And finally, you can have immunotherapy, because such kind of antigen from pollen from trees can cause allergy. So if you put a small amount of allergens repetitively, then you have a power to prevent the allergic symptoms. So that is immunotherapy, and it is delivered by injection therapy or sublingual medication. So other treatment options will be delivered by either oral medication or a spray type of a nasal spray or a bronchial spray, or sometimes eye drop for allergic conjunctivitis. There are various options in the prevention and treatment of allergic disease, particularly seasonal pollinosis in this season.
Right, I see. Professor Kim, pundits are also warning about cardiovascular diseases in the springtime amid the dramatic fluctuations in temperature, which is something that Professor Jung touched upon earlier as well. What is the link between temperature and cardiovascular conditions?
That's a very complex question, so my answer is going to be also very complex. Blood pressure is controlled by autonomous nervous system. Heart pumps out the blood that is needed for circulation, but the vessel tone is also very important to maintain our blood pressure. So it has a very complicated mechanism. As temperature rises and the daily temperature range increases, that triggers cardiovascular disease, and usually we have a higher number of admission due to cardiovascular disease in elderly group. There was a very big study from Japan, including more than 1 million adults, and they say that if your age is more than 75, either man or woman, they have a higher risk to have heart failure, angina, myocardial infarction, arrhythmia in that high daily temperature range. So if you have an underlying cardiovascular disease, you have to keep warm during the lower weather temperature, and you better keep cool in a higher weather temperature. And you better reduce exposure to greater changes in weather temperature to prevent cardiovascular episodes.
I see. Professor Jung, do correct me if I'm wrong, but I understand that fine dust, which is very common here in the country this time of the year, it may also aggravate cardiovascular conditions. Could you explain this for us?
Yeah, that's correct. The fine dust, another name is SPM, suspended particulate matter, is going to be a big problem in near future. Because the fine dust can easily get into our lung and it stays there, and it causes inflammation. It releases interleukin 6, 8, TNF-alpha, and all the very bad inflammatory materials over there. Then the materials circulate in the body, and it causes various kind of inflammation, also in vessel. And in vessel, if you have inflammation in vessel, you have a thrombosis, clogging of a vessel, and another type of inflammation over there, and atherosclerosis will be followed by that. And also, the very fine dust get into a vessel itself, and it circulates in your body, and it also causes inflammation. If you have a very severe inflammation in the circulation system, it causes thrombus, and it causes sometimes ischemia of a target organ. So finally, it ends up with hypertension, and ischemic heart disease, which is another name is myocardial infarction. And as Professor Kim mentioned about the body temperature, the fine dust also causes ischemic disease and also causes arrhythmia. So the fine dust is going to be a most threatening agent for our children and for our future. So we need to prevent it. And we need to prevent not only for protecting ourselves by mask wearing and ventilation and all, etc., but also by making a proper policy to reduce biomass fuel production, diesel combustion, and biomass fuel like coal power planting is most dangerous one. So we need another type of power plant, such as using a solar energy, wind power, or even nuclear power would be better for our health, in terms of fine dust hazards.
Right, of course, I'd have to agree with you right there. Professor Kim, Professor Jung just mentioned ventilation. I was actually going to ask you, should people seek to ventilate their homes even when there is a fine dust warning outdoors? Because I feel compelled to close my windows shut very tightly when I hear there is a fine dust warning outside.
I think we have to think, it depends on the situation. Before I mention about the fine dust outside, I would start with the indoors situation. Usually the average indoor level of those fine dust without compulsion appliance is about half of that outdoors. So we can say that it's safe to stay indoors during those fine dust periods. And what kind of indoor pollutants do we have here? We have fine particulate matters. If we cook something, if we hit something, heating system, you might have some indoors problems also. So whenever you cook something, you might have very small particles floating around. So you might have to ventilate somehow. And I cannot say exactly how we should do, but as I mentioned, it depends on the situation. So as we have our mobile phones and all the apps show that what's the situation outside, you check it, and you can open your windows briefly. And
how briefly? Are we looking at 5 minutes or 10 minutes?
Yeah, it depends. And I think you should have enough time to have a total exchange of air, at least 10 minutes maybe. But there's some research about the timing of the ventilation. We may think that the early morning might be a good time to open the windows, but just after the rush hours, and we have many dust floating around. So there's some research that maybe at noon might be better. So you open your windows, and I think many homes already have the air purifier, and you can use that one, but after cooking, you might still have to open the window because that kind of machines is not enough to clear the
air indoors.
Yeah.
I see. Professor Jung, how can members of the public here seek to reduce the harm of air pollution on their health while we wait for other industries to ease their carbon footprints?
Well, there's no definite answer for that. Whether you're staying indoor or outdoor, there will always be pollution, indoor pollution, both outdoor pollution. But you have to do your best to keep your atmosphere without any kind of very harmful dust. So I like to recommend, again, the mask wearing when you are going out, particularly if you are on a very high-risk group. You have respiratory disease, underlying heart disease, diabetes, and etc. So the KF94 mask is highly recommended. KF means a Korea filter. 94 means 94% prevention of 0.4 micrometer size. Less than 0.4 micrometer size, a very fine dust. You can prevent 94%. Why you don't have any reason why you don't take a mask if you have a air pollution warning sign in the morning. And he mentioned about the ventilation during the midday. I also agree with that because not only for pollution, but also for pollens. There are more pollens in the morning rather than afternoon. So if you open a window in the morning, you can have more pollens inside your house. So that is another kind of prevention measure. One other thing I would like to recommend is keep your humidity very high. So at least 40% will be needed in order to keep your body very sound. But it's not easy to keep your humidity indoors about 40%. It's not easy at all. But at least I would recommend 30% of humidity in the rooms. If you keep those kind of humidity, you can prevent not only for air pollution, but for another kind of respiratory infection by increasing immunity by increasing defense power in the mucosa of your bronchus and your nose.
Right.
So there are several means, but the utmost solution is make a very nice policy to keep our air clean in our territory.
Right, hopefully that will be likely in the near future then. On a light note, Professor Kim, is there any rationale behind the common belief here in the country that eating pork meat will perhaps prevent you from the harms or the possible harm of air pollution from fine dust?
Oh, I don't know where it came from. I think there's no evidence for that, but I understand there was a time that people working at the coal mine, used to eat a lot of pork after digging some coal in the very dusty canals way below the earth. And I heard that some young people even thought that they might have less side effects if they have pork after COVID-19 vaccination, but there's no evidence for that. So I would rather say, as Professor Jung mentioned, hydration is very important. You better drink enough water. If you drink water when you feel thirsty, that's not good. You better drink to prevent any dehydration.
You need to keep yourself hydrated then.
Yes.
And I was wondering then, Professor Jung, there are some people who believe, apart from pork, that having vitamin C could actually prevent you from common viruses. Is there any truth to this statement as well?
Yeah, there has been a long belief that vitamin C can prevent the cold. But as far as I know, there is no very evident evidence or published data for that. Because vitamin C is water soluble. If you have a lot of amount, then you can excrete through your urine and or by sweat. So there's no use of a very high amount of vitamin C just for preventing a cold.
I see. So in the meantime, what we can believe in, though, is to have a lot of water, then to drink water, keep yourself hydrated, and also use your face masks when the pollen rate is very high outdoors or if the fine dust rate is high. All right, Professor Jung, thank you so much for your time and your thoughts today. And Professor Kim, thank you very much for your insights.
Thank you.
Right, well, that ends Tuesday's edition of Issues and Insiders. Thank you for watching. Do join us again same time tomorrow, that is Wednesday.